right, so in the cardiovascular system, of course, there are different labs and procedures that can be used to aid in the diagnosis of cardiac injury, cardiac damage, aid in the diagnosis of myocardial infarction, etc. So let's get into some of those. So your cardiac markers, when you suspect that a cardiac event is occurring, such as an MI, you want to check cardiac markers. That way it provides that supporting evidence for that specific differential diagnosis. So those include troponin, creatinine kinase, CKMB or creatinine kinase, or the myoglobin. So your troponin, a normal level is less than 0.35. An elevated troponin has a high affinity for myocardial injury. Troponin, it consists of three proteins, troponin C, cardiac troponin 1, and cardiac troponin T. The general troponin that we refer to within the cardiovascular system refers to troponin 1, just in case that comes up anywhere. The CKMB, so normal is 2 to 6 for males and 2 to 5 for females. An elevation in the creatinine kinase, CKMB, does indicate myocardial damage, and an elevation occurs within hours and peaks at 18 hours following an acute ischemic attack. The myoglobin is one of those cardiac markers that is not cardiac specific. So it is an oxygen binding protein found in both cardiac and skeletal muscle. It will rise within 2 hours after cell death with a rapid decline after 7 hours. However, remember, it is not cardiac specific, whereas your troponin and your CKMB are cardiac specific. All right, so CBC, changes in the CBC secondary to cardiac damage. So when thinking about changes within a CBC, again, we need to learn and understand how to link those lab values to changes that are occurring in the heart. So with cardiac damage, the white blood cell count will increase. It always increases in any infectious and inflammatory diseases of the heart. So just visualize that a large number of cells are needed to aid in the disposal of necrotic tissue secondary to infarction, thus resulting in an elevated white blood cell count. So if there's damage, there's infarction, the body calls a large number of white blood cells to the area to get rid of all of that damaged and necrotic tissue. Also, hematocrit levels will increase due to volume depletion, often hypovolemia. So blood coagulation factors, these may also increase during or after an MI. So that's what places the patient at a greater risk for thrombophlebitis or the formation of blood clots in the coronary arteries. Homocysteine levels. So normal homocysteine levels are 4.5 to 11.9. Elevated levels equal an increased risk for cardiovascular disease. So if those homocysteine levels are elevated, you're at an increased risk for a cardiovascular event. CRP or C-reactive protein is always elevated in an inflammatory process. So a CRP of less than 1 is equivalent to a low risk for the development of heart disease, and then a CRP of greater than 3 puts the patient at a high risk for the development of heart disease. BNP or B-type natriuretic peptide, a normal value of a BNP is less than 100. BNP is a marker for heart failure, so BNP is released and elevated in response to any arterial or ventricular stretch. So the higher the level of BNP, the more severe the heart failure is. Holter monitoring. So Holter monitoring and of course an EKG are ways to monitor different cardiac events. There will be a separate EKG video within the course specifically going over how to read EKGs and different cardiac dysrhythmias that you'll see on EKGs. But in this section, we'll just speak about Holter monitoring. It is non-invasive. It's usually worn continuously for at least 24 hours. When it is prescribed outpatient, it can be worn for up to 21 days. It monitors and identifies any dysrhythmias that occur in a patient's day-to-day life. It can also be used to evaluate the effectiveness of any antidysrhythmic medications or pacemaker therapy that the patient may be on. Whenever a patient is wearing a Holter monitor, it's very important to instruct the patient to keep a log of daily activities. And then usually most Holter monitors will have a button to push when the patient experiences any symptoms such as palpitations, chest pain, lightheadedness. They'll be able to push a button and that will record the cardiac rhythm. So if you keep a diary and then you're pushing your button, the cardiologist will be able to correlate cardiac rhythm to any specific activity that you may have been doing at the time. So an echocardiography, it's non-invasive. You're going to instruct the patient to lie still and avoid talking. There is a such thing as a transesophageal echo, which is used to visualize the posterior structures of the heart. So an echo can be used to detect any valvular abnormalities, wall motion deficits, ejection fraction of the heart, and just cardiac function as a whole. Exercise stress test. So the treadmill is the most commonly used mode of stress testing. You want to educate the patient on the importance of avoiding any smoking, caffeine, or alcohol prior. You don't want any caffeine or anything that's going to cause any premature tachycardia. You want to instruct the patient to wear very comfortable clothing and avoid taking a hot bath or shower for 1 to 2 hours after the procedure. If there's ever a patient that is unable to tolerate exercise due to shortness of breath, chest pain, obesity, whatever it may be, there is an option to receive IV medication, which will stimulate the effect of exercise by stimulating the coronary arteries. This medication is they usually use a medication called dobutamine hydrochloride. This is, if this is the option or the path that a patient has to take in completing a stress test, it is treated as an invasive procedure in the means that the patient is NPO or nothing by mouth for 3 to 6 hours prior. It's important for a patient undergoing a stress test, it is very important to inquire about any medications. So calcium channel blockers, beta blockers, they would be held the day of. These medications slow the heart rate, so holding them will ensure that the heart rate will be able to increase appropriately during the stress test. But there are many medications that may need to be held for 12 hours prior or the day before stress test. So it's always important to do that medication reconciliation on a patient that is getting a stress test done. So an MRI, of course, is non-invasive. Metal objects are contraindicated with an MI. With an MRI, I mean. So you would want to evaluate for a pacemaker or any other devices that would be contraindicated. Of course, a side effect of MRI is claustrophobia. A lot of times you will have to, as a provider, not as a nurse, you would have to prescribe a 1 to 2 doses of Ativan or Xanax, something to kind of calm the patient prior to the MRI in order for it to be completed. So an MRI, it can provide information on chamber size and thickness, ventricular function. It can also look at blood flow through the heart and also look at the coronary arteries. For a heart catheterization, so a heart cath is invasive. It involves the insertion of a catheter into the heart and surrounding vessels. The patient does have to be NPO for 4 to 6 hours prior. So in a right heart cath, which is a very common one performed, the catheter is usually inserted through the right femoral vein in the groin area. The catheter is then advanced into the inferior vena cava, down through the right atrium, into the right ventricle, and then the pulmonary artery. In addition to vital signs, post-op, it's very important to monitor the extremity distal to the catheter insertion site. So with that right heart cath, if they inserted the catheter into the right groin, you want to make sure to monitor the lower extremity pulses to check for any, cyanosis, numbness, tingling, anything like that. And then remember, anytime a dye is used, just think that dye will have to pass through the kidneys, meaning that the medication could be meaning that any medication that could be harmful to the kidneys will need to be discontinued prior to that procedure. The dye is already a little harmful to the kidneys, so you don't want additional harmful medications in combination with the dye to cause an AKI or anything like that. So always think about the importance of adequate hydration post-procedure that will aid in flushing the kidneys. In addition to post-procedure, you want to collect labs to monitor for kidney function. But one of those medications that will be discontinued is metformin. So if a patient is on metformin and scheduled for a procedure that requires iodine dye, the metformin should be held 24 hours prior due to an increased risk of lactic acidosis. So just remember, post-op, anytime a dye is included in a procedure, you want to encourage hydration and monitor those renal labs very closely. So this is another procedure that can be used, a percutaneous transluminal coronary angioplasty, or PTCA. So it's performed on a patient who is actively having an MI, either alone or in combination with other medications. It is used to increase blood flow to the heart. So I want you to think about it. There is plaque buildup in the arteries restricting blood flow to the heart. So how do we open up the artery to increase the blood flow to prevent further damage? So we're going to do that through a PTCA. So a balloon-tipped catheter is positioned in the artery. The uninflated balloon is then centered in the obstruction, and the balloon is inflated, which then flattens the plaque against the artery wall. When the balloon is removed, the artery is left unoccluded. So just some facts that you'll need to know on the NCLEX about the PTCA, that procedure. Lifestyle modifications are needed afterwards. So it's not permanent. So reocclusion may occur. So the patient really needs to understand the importance of stopping smoking, adhering to a healthy diet, losing weight, exercising, in order to prevent occlusion from happening again in the future. Anticoagulants may be prescribed post-procedure for the prevention of thrombus formation, and chest pain may occur during the actual inflation of the balloon. So oftentimes a coronary artery is utilized during a coronary artery stent is utilized during this procedure to prevent reclosure. So a coronary artery stent is that same procedure of the ballooning, but a stent is placed that kind of provides a scaffolding, improving the long-term patency of the vessel, eliminating the risk for acute closure or closure in the future as well. So the major concern post-procedure after placing a coronary artery stent is acute thrombosis. So the patient will either be placed on aspirin or Plavix for several months to prevent any blood clots from forming. All right, so coronary artery bypass grafting. So the occluded coronary arteries are bypassed with the patient's own venous and arterial blood vessels. You can use either a saphenous vein or internal mammary arteries. So this is performed when there are severe occlusions and the patient has not responded to any other medical treatment. It is a major procedure. Several prescribed medications will be stopped prior, so diuretics are usually stopped 2 to 3 days prior. Digoxin is usually stopped 12 hours prior, and then any aspirins or anticoagulants are stopped 1 week before this procedure. So post-procedure after a coronary artery bypass graft, this patient will be in the cardiac ICU and on a mechanical vent for 6 to 24 hours. They will usually have 2 chest tubes, one to the medial sternum and one pleural chest tube. You're going to monitor the blood pressure. That's going to be very important because hypotension could result in collapse of the vein graft, whereas hypertension could cause leaking from the freshly inserted stitches. So it's very important to monitor the blood pressure to keep it normalized. Of course, breath and heart sounds should always be monitored and labs should always be checked, looking at that WBC pretty frequently to assess for any signs of infection.